Hi, thank you for joining my talk today. My name is Mohammaad Tahaei. I'm going to talk to you about our paper, Privacy, Permissions, and the Health App Ecosystem, a Stack Overflow exploration. This is a work I did with Julia Berndt from International Computer Science Institute at Berkeley and Owais Rashid from the University of Bristol. We're living in a world where we've got all sorts of health devices and fitness trackers that record our health data, and these data can help us understand and improve our lifestyle. However, data is used or sold to unwanted third parties. There are even specific laws to protect people's health data, but yet, still this type of data is tracked and sold. So in this research, we wanted to understand how developers of health apps understand and navigate through privacy-related issues. On the other hand, when we look at developers in general, they have trouble understanding privacy tasks. Examples include writing privacy policies, handling permissions, or understanding legal requirements. And as I said, we've got specific laws to cover health data that developers need to comply with. But in general, translating legal requirements to technical requirements is a known challenge in software development. As I said, so far there have been studies to understand general privacy issues for developers. However, there hadn't been a study to specifically focus on privacy problems with regards to health data. This type of data is important because we've got specific laws to protect this type of data, and users are also specifically concerned about sharing their health data with unwanted parties. So in this research, we focused on three research questions. The first research question is, what privacy-related challenges do app developers face when integrating health-related features? How do the challenges differ when developing health apps for different platforms? How do health app developers navigate through these privacy challenges? To answer our research questions, we queried Stack Overflow for any posts that included fitness, Google Fit, health, medical, and Android, iOS, watchOS, and Wear OS, specifically in titles and tags from 2016 to 2021. We collected in total 1,055 posts, and then we manually narrowed down this number to 269 posts that were specifically about health and privacy. In this process, we selected posts that were both about privacy and health. Then we did a bottom-up thematic analysis of the final dataset, the 269 posts about privacy and health. To analyze the data, the final dataset, we did a qualitative analysis with two coders and calculated inter-rater reliability. You can find the details in the paper. Here you can see a sample post from Stack Overflow. The asker had trouble understanding why their app was rejected by Apple App Store because of a problem they had with HealthKit, iOS's health framework. We're looking at these kinds of issues that were raised by developers and also looking at the solutions that they brought up to better understand the challenges and the proposed solutions, which I'm going to talk about those in the next slides. Overall, we find that about 25% of the initial dataset was about privacy. So about a quarter of posts that were related to health were also about privacy. In terms of different operating systems, for posts about Apple and Google supported operating systems, a quarter of health posts were about privacy. Here you can see the number of posts over the course of the 5 years that we studied. As you can see, there has been a kind of a steady trend in iOS, and Android had a drop in 2018 and then started to pick it up again from 2016-2019. We speculate that might be because of the GDPR and how it impacted Android and Google Play, and therefore developers started to react to it as well. So about 40% of posts were around iOS, and about 40% again were specifically about Android. So in terms of operating systems, we did not observe a big difference between the number of posts that were about health and privacy. In terms of specific frameworks, because frameworks are one of the main drivers of developers' questions, when developers see some problems related to frameworks, they ask questions about them. Again, both HealthKit and Google Fit had similar numbers. Roughly about 45 to 50% of the posts were about these two frameworks. Here's a table from our qualitative analysis. As you can see, this is a huge table. So I'm not going to go through all of it for this talk. Instead, it's just going to give you some ideas about what kinds of themes we found through our analysis. We found that problems or inspirations for asking were specifically around when people had problem with access to resources, or whenever they saw an error or a crash, or whenever they saw some kinds of App Store submission or review problem. We also looked at the sources of the problems. App Store requirements, third-party components, and sometimes ethical considerations were the main sources of the problems. In terms of proposed solutions, a lot of the times people just had to fix the permission problems or sometimes authentication problems, simply by just changing the code a little bit, or sometimes the error wasn't actually related to health issues and it was related to something else, or they had to fix some other code issues. We also coded for attitudes and wishes. When people explicitly mentioned something, most people had usually confusions about requirements, or they were asking for better documentation or feedback from the app stores. We also looked for references to external resources. Official documentation was usually the main cited resource. We also looked for privacy when it was explicitly mentioned in the posts. About 9% of the posts were specifically talking about privacy or sensitivity of health data. In terms of common problems that we saw in the questions, as I said, access to protected resources was the main problem people had, or the main driver of asking a question. Whenever they wanted to read health data, either from a framework or a sensor or some device, or write data to a framework, they had trouble or issues that they wanted to better understand how they can fix it. Sometimes they posted a specific error or a crash report, and they wanted to know why that happened. In some cases, they posted questions about a review or a submission problem. In this post, for example, the asker is asking for help about the submission problem. I'm having trouble getting my app approved, and to be honest, I'm having trouble understanding what Apple are on about in this case. My app only uses HealthKit to create, pause, and finish a workout. It doesn't read any data. A quote from the feedback. The problem appears to be with my watchOS app not asking for permission to use the health data or the health app. We looked at the common sources of problems as well. So in the previous theme, we studied the problems, but here we're looking at specifically at the cause of the problem. It was mostly about the frameworks. So as you can see, the main driver is usually the framework itself, either HealthKit, Google Fit, by Apple and Google. And in some cases, they had trouble understanding third-party components and App Store requirements. In a few cases, we had people considering ethical considerations as well, which was interesting. For example, one said, Apple unfortunately won't allow you to get the Apple ID for the user, as this would be a privacy concern if any app could access that information. In terms of common proposed solutions, most of the time people suggested adding a permission that people forgot or simply fixing the syntax. And in some cases, people suggested that you just need to follow the health specific requirements by app stores. And sometimes the problem wasn't really related to health problem, and they had to fix some library code or non-permission related code. I'm going to talk about some of the implications of our study. Mainly, we find that the triggers of privacy discussions are usually software development platforms, specifically Android and iOS. This includes problems with health data as well. We observe that developers mostly want to satisfy OS requirements that are established by the app stores to make sure that they can distribute their apps. There might be some effects and some impacts by the regulations and laws. For example, the spike in the number of posts in 2018 might have been a result of the GDPR and app stores changing their policies. While this is a speculation, it seems like laws can be a good way or a starting point or an initiating point for conversation around privacy in the technical communities. In terms of design, we believe that official documentation is very important because official documentation remains the most cited resource for developers and some of them had trouble understanding it. Therefore, any improvement in the documentation can have huge impacts on the developers' workflows and their understandings of privacy implications as well. We think that the post-submission checks needs to be integrated in the IDEs. So instead of developers submitting their app to app stores and getting some reviewer feedback, those checks need to be integrated in the IDEs during development. And last but not least, of course, sharing with third parties remain a big issue. Third parties need to transparently communicate their data practices to developers and users so that they can understand what's going on and make informed decisions for their apps and their users. Thank you very much for listening.